Thanks, Hallie. In today's health alert, cases of whooping cough have surged to nearly 3 times higher than in 2023. According to the CDC, 4,800 cases have been reported up to week 21 of this year. That's compared to 1,700 cases during the same period last year. So for more on this, we're joined by our chief health editor, Dr. Partha Nandi. And Dr. Nandi, obviously that number is concerning. And where is the area of most concern?
Yeah, it's interesting. We're talking about whooping cough. It's 2024. Whooping cough is very contagious. Pertussis is the actual medical term, and it's an infectious respiratory disease, Glenda, caused by the bacterium Bordetella pertussis. People call it whooping cough because of the distinctive whoop sound that patients make when they try to catch their breath after coughing a ton. Now, why this happens is because the bacteria attach to tiny hair-like structures in the upper respiratory system. They release toxins and then damage the airways and cause swelling. Symptoms can really start with a runny nose, low fever, and a mild cough. However, for some folks, the coughing fits can be so severe they lead to vomiting and even difficulty breathing in some cases. People can even bruise or fracture their ribs, so this is big time. As for where we're seeing the most cases, New York, Pennsylvania have experienced increases. Last week, 138 new cases were reported across 15 states. Schools are also affected with reports of outbreaks in Pittsburgh, Pennsylvania, and Minnetonka, Minnesota. So this is all over the country.
And it's so hard to watch children who have it. I mean, especially as a parent, you just want to take it out of them. There is treatment, there's a vaccine. If you get that and you are a child, does it last you a lifeline?
Important question, right? Okay. So the answer is no, right? In the U.S., 2 types of vaccine, Glenda, help prevent whooping cough. Both also protect against other diseases. DTaP vaccines are given to babies and children younger than 7 years of age, providing protection against diphtheria, tetanus, and pertussis. For older kids and adults, they are given Tdap vaccines, which offer protection against tetanus, diphtheria, and pertussis. However, many people mistakenly believe that, hey, once they're vaccinated, they're protected forever. But immunity from the whooping cough vaccine can decrease over time. And that's why the CDC recommends adults receive either a TD or Tdap booster dose every 10 years to maintain immunity levels. As for treatment, right, antibiotics are typically prescribed to help control symptoms and reduce severity. If pertussis is left untreated, it can be very dangerous, important to know, especially for infants and those who are immunocompromised. Complications can include pneumonia, seizures, brain damage, and even death. So very, very serious. And that's why it's so important to get vaccinated, people. Before the vaccine, there were around 200,000 cases of whooping cough annually among children, and roughly 9,000 died. Since its introduction in the late 1940s, the number has significantly decreased, dropping by more than 90% compared to the pre-vaccine era. So it does work, so get vaccinated. Again, I'm a little disappointed that we're talking about whooping cough in 2024, but we can beat it as long as we follow the recommendations.
Yeah, and every 10 years is so good to know.
Absolutely, and people don't know that.
All right. Thanks a lot, Doc.
Hey, my pleasure.
Appreciate it.
Go green.
Go white. And if you have a health question for the good doctor, you can email him, Dr. Nandi at AskDrNandi.com, or send it to us on Facebook or X. We'll get it right to him.